This is Waves, a podcast from APTA Michigan. I'm Andy Wicks. If you're a PT, a PTA, or a student of either, and you spend any amount of time on social media, you may be familiar with the account DPTs with Anxiety. You may be less familiar with the account's creator, Dr. K. Mastrocola, who started it as sort of an assignment. We discussed her unusual path through DPT school, how she became a PT influencer, and how sometimes we can be the total package and be sent to the wrong address. Enjoy.
All right, Kay, why don't you introduce yourself however you see fit?
Hello, my name is Dr. K. Mastrocola. I am a pelvic health physical therapist and an online internet meme maker. I have the Instagram and TikTok page DPTs with Anxiety, which helps kind of bridge the gap between mental health, higher education, and healthcare. And I'm really excited to be here kind of talking to you all and answering some questions and just talking a little bit about my journey as a PT.
Excellent. When I told my students that I was interviewing, I was like, I'm interviewing the person behind the DPTs with Anxiety page. They're like, no way, really? So you're pretty popular among my students. And I admit I get a hearty chuckle at your posts as well. So
glad.
Yeah. So I guess I'll start with the big question. How and why did you start DPTs with Anxiety? And did you see it becoming what it has become?
Yeah, I love this question so much because I did not want to start this page. This page started as a challenge for my therapist. I was really struggling in that transition phase of clinicalship where I was like, okay, I've got 2 clinicals under my belt. The first one was great. The second one, they were giving me feedback that, I didn't necessarily agree with. I was having difficulty seeing where they were coming from. My neurodivergence was becoming an issue in the space in a way that it wasn't being accommodated to or valued in the ways that now as a clinician, I see it's incredibly valuable. And so I was like, no one's going to trust me. I can't be trusted with a license. I'm going to kill somebody by accident. And my therapist was like, okay, slow down. How do you cope right now? And I was like, I make memes and I send them to my friends in the group chat. And they were like, oh, send me a meme. And I was like, okay. So I sent her one. And she goes, no, this is really funny. You should post this on the internet. And I'm like, you're out of your mind. She knows me. I've worked with her for 6 years before this all happened. And she goes, okay, well, your homework is to post it on the internet. And I'm like, dang it, I love to people please. And so I was like, well, no, I can't post this on my personal. No one can know I'm mentally ill. They all knew already. And so I went and I posted on this alias, DPTs with Anxiety, and no hashtags, no anything. And the first post was this goat that was biting a table. And it's when the answer is always, it depends. And it got 30 likes. I got 10 followers. I'm like, where are y'all coming from? I'm not trying to make this. I did it to prove my therapist wrong. And it proved me wrong in every single way that I couldn't even imagine being beneficial.
That's hilarious that your therapist is like, yeah, go ahead and prove me wrong. Just try it. See what
Just
happens.
try it. Yeah.
Well, and that's hilarious because if you're listening to this and you're not familiar with DPTs with Anxiety, please go look it up because it will make your day. But you usually post the same picture a few times with different captions, and every single one of them yep, I relate to that one. 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 And I think you do a good job of kind of encapsulating, you get a little flavor for everybody there. And I will say, I'm going to just the one bone to pick I have with you is, why don't you toss a little faculty perspective in there from time to time? You got a lot of student perspective in there, but
Whoa.
But
that's a good point. I think I'm still healing from some academic trauma, but once I get on the other side.
No, I get it. So, and you, in addition to being internet famous within a very niche group, but you also you're a public health therapist. And how long have you been practicing now?
I have been out for 3 years now, which is awesome. And every year I just find myself getting better and more confident and more I made the right decisions in every single way of what I did. I cannot imagine the debt to income ratio of being a PT. We can't shy away from talking about that and the choice of profession. But in comparison to the job satisfaction, there's a reason that PT is on the list of top 10 most satisfied careers every single year.
Yeah.
And I come home from work every day and there's some days that are better than others, some days that are more, emotionally involved. but overall net positive. Like, I'm like, wow, like I actually matter to people. And that's a really, really cool feeling.
A good friend of mine and former co-host of the podcast here she's also a pelvic health therapist. And we've talked about this a lot. I think that the pelvic PTs have been ahead of the curve compared to the rest of the PT world in terms of like knowing how much of a difference they can make really, and kind of getting to really see that, firsthand with their patients a lot, which is awesome. And I wish that was something that was more common among other flavors of PT. And I think it is to an extent, but it's just not, it's not the same.
And I think a lot of it is like a byproduct of the system. Like pelvic PT, you are specifically like mandated one-on-one with a patient.
Yeah.
And there's a different level of connection there compared to like more of like an outpatient style. And I think that, I am not naive to like the lens that I have in a very privileged scenario of working with cash pay, like pelvic health clients, and just being aware of that too. When I'm asked to speak about burnout and stuff like that, I'm like, listen, my story is mine and there are ways to find this within your profession, but it's also like an active part of like championing our worth and that benefit of one-on-one care.
Mm-hmm. Mm-hmm.
So
the name of the account is DPTs with Anxiety. It's not DPTs who make funny memes. So I guess I want to touch on that because a lot of what I do in a lot of my research has to do with like student mental health and student well-being. And it's something that's very, very much important to me. But I guess I want to know, was this just a name you came up with for fun? And did you realize how many people would relate to that?
I had such crippling anxiety that was exacerbated going to college. I did a 3-3 PT program, so it was very quick, very streamlined. My second semester of freshman year, I got a gnarly TBI that only made things that much harder from a mental health perspective, like falling behind. And so anxiety, as I, created this account 4 or 5 years later, was more of like an era of healing. And I think it's really cool to see the internet moving in that way of like embracing neurodivergence and talking about ways to like celebrate and also find ways. And as the page kind of grew, it became like, okay, am I making something that I needed? Because for so long, I was so ashamed of the anxiety and what then later was diagnosed as ADHD and then was later diagnosed as, XYZ, and kind of creating a space. Like at first I was like, oh, like this is funny because I have anxiety. It kind of rhymes. It's fun. And now I'm like, oh no, like this is like a pillar of identity. And like, I am an anxious person and that is okay. Like it's a reclaiming of the narrative for me, which is really
like that.
cool.
I like that. Yeah, I think that one thing I noticed when I became a faculty member, one thing I hadn't anticipated was the amount of mental health care our students needed, and the forms that took in terms of sometimes it was just students coming to me after class and sometimes just venting and kind of dumping, and sometimes it was us kind of picking up on like, hey, so and so looks like they're not their usual chipper self today, like, everything okay? And it's interesting to think about how where I work, I feel very fortunate that the faculty as a whole are very like in tune for that kind of stuff. It's a very different experience from when I was in school, but I think part of that is just the time that I went to school, because I think, I had some great faculty, but it wasn't kind of in that forefront. And I feel like it is a lot more now, at least in terms of the resources that are being offered. So I'm encouraged by that. And I know my students tend to be, like I said, they're big fans of your account already, but they seem to, it just isn't as stigmatized a thing as it used to be.
Yeah. And I think, again, that comes back into like reclaiming the narrative. And if there's one advice that I give to faculty when they're like asking me, it's like, how can I be better for my students? It's like, in that first day PowerPoint, they're used to the Title IX stuff. They're used to all of that like academic integrity. But are they used to a slide that's like, hey, if you're experiencing this, here's a list of all the resources. So, because if you look at someone like me with executive dysfunction and I am in a spiral, it is so incredibly challenging. Like the water might only be 4 feet, but I am still drowning.
Yeah.
I cannot get above water. So how am I supposed to even know to look for the resources?
Yeah.
And if I have this like one slide that I can click on and be like, point A, here's who I click and call, that takes that executive functioning. And it also shows that like, oh, this person is safe.
Yeah.
This person understands that like going to college, going to PT school is such a huge shift. And we're not like you're removing yourself from your families. You know, I moved from Jersey to Missouri. I'm a very hyper independent person, and I didn't expect to crash out the way I did. And it's so humbling in a way to like have that support system. And if I didn't have people like around me, like my RAs and stuff, moving me towards therapy, DPTs with anxiety wouldn't exist.
Yeah. Well, it's good
But
you
I
had
love
that
that
support.
it's becoming important. Yes, yes.
Yeah, I've had students where, because I'm entering my 4th year as a faculty member, and you know, starting to feel like, okay, starting to feel like I have an idea what I'm doing. But
Yeah.
the big thing that was the training and resources that we were provided as faculty of like, hey, here's the counseling center, here is the crisis line, here are the, so we have those resources, but I can do a better job of being like, here on day 1, boom, you need help, call it. Don't even bat an eye.
And I think like the power of I don't know, but we'll figure it out is really, really powerful to a student. I sometimes wish I had more faculty try to just tell me I don't know and sit with me. Because like I had a lot of other stuff going on. My dad was really sick in PT school. Like I wasn't sure if I was going to have to fly back and forth, some financial stuff that came up with him being sick. And, stuff that doesn't always come across the faculty's desk is high and dry. Like I'm a first-gen college kid. How am I supposed to do X, Y, and Z? Having a faculty member who sat down and he's like, I don't know, but let's figure it out. Or I'm going to continue to be your contact person. That was the buoy in the water that I latched onto. And I'm so, so grateful. And that support system, like if you have it, like don't be afraid to ask for it. Most faculty who are PT faculty are PTs who went into a profession to help people.
It's true.
So they want to help you.
Yeah. Well, and it's funny that I think any PT who's been practicing for any amount of time can recognize, and I'm going to include you in this case because again, you're in pelvic health, that there is an aspect of our job that is like, I'm not a psychologist, but I play one on TV kind of thing. We tend to get a lot of those situations with our patients and things like that. And I think as PTs, it's easy to be like, not easy, I should say, but it's a part of the job to kind of listen and be that listening ear. But it's not our job to be a psychologist or a counselor. Like that's not what that's not in our scope of practice. But we can still be decent human beings and listen. But then to say, hey, you know what? Thank you for sharing this with me. And I feel like there's someone out there probably more qualified than me to talk to. Let's see if we can figure that out. And that's been a hard transition for me as a faculty member too, of not being like, let's figure it out right here in my office. Like, no. Like, thank you for telling me, here's the University Counseling Center line. Let's give them a call because this is above my pay grade all of a sudden. And I think that's a big step.
On the topic of neurodivergence and like learning curves and stuff too, my husband has been the most amazing, like we've been together 9 years now, and he has autism and I have ADHD, and the compliments in that neurospicy relationship is insane. And he was truly one of the first people, and I was like melting down. I can't even tell you what it was over. And he looks at me and goes, that sucks. And I was like, it does. It does. Like, no one tried to fix it. He was just like, I'm calling it what it is. And I think, and I say that to my patients too, like they'll just tell me like, in pelvic health, it's intimate. And I'm like, that does suck. And then we move on. And because sometimes people just need to be validated. And like, that's what I kind of like about my page is it's like, I'm not trying to cure depression. I'm just trying to give people a lighthouse so they can like see that like, yes, that is me too. And like we laugh and we move on, and like, but it starts that conversation of like, oh, why are we laughing about this? Because that's like, woo.
Yes, but it's
like, where do we all shouldn't be sad.
To be seen, to be heard, to be validated is so important, and
it's powerful.
It's incredibly powerful, and I think that no matter what your role is when you're working with someone else, and that you acknowledge them, and it doesn't even have to be anything more than that. Like you said, it's like, yeah, that I see the situation you're in, and I can tell that sucks, and they're not asking for anything more than that.
Yeah. And that's my biggest advice to new grad all the time is it's like, you don't have to have it all figured out because you are so lucky to be in a profession to where you get to see them 2 to 3 times a week, 1 time a week. So if you don't test their internal hip rotation this week and you go back and you're doing it like, oh, I should have done that. That could have told me something. Do it next. They don't know. If you did the Thomas test wrong, they don't know you're doing the Thomas test wrong. Like, just do it again.
Yeah.
Like, it's such a privilege to build that rapport. A patient once told me, and it sticks in my head forever. I want it like tattooed on my forehead. And I'm pelvic, but I kind of treat everything here and there. And she had some carpal tunnel stuff going on. And I was like, I can't remember the name of like, I think it was like flexor digitorum or whatever. So I'm like, hang on, I have to Google this to like know. And I was like, I'm sorry, this is like so stupid. I should know this. And she goes, no, you went to school to know how to like translate Google, not be Google.
Ooh.
And I was like, so, whoa.
Oh, I like that. That is good.
And as a provider, I was like, hell yes. Like, I know what to put in the search bar. I just don't remember this one little itty bitty thing. That doesn't make me a bad provider.
Exactly.
Like,
it means your memory has a limit,
all.
and sometimes little names of muscles just get shoved out of the way, and that's why we have Google.
Listen, there's a part of my brain where math is supposed to be, and it's like 80% Disney random fun facts and like 10% recipes from TikTok. Like the rest is just
nice. That's awesome. Wow, I love that. I'm going to steal that line too. You went to school to interpret Google, not to be Google. All right. I want to shift gears a little bit, if we may. You posted recently, and I'm glad that I saw it because I was like, ooh, it's actually, I think, your most recent post. You talk about being on academic probation when you're in grad school. Are you okay talking about that?
Yes, let's dive in.
Okay. And it caught my attention because, again, I'm a faculty member, so I've been on that side of things and kind of seen what it does. And it's not fun, I think, for anybody. I guess I would like to know broadly, your experiences with it and how because even though you were there, you still are here now. It didn't derail you. It didn't stop you. But yeah, share your experience as much as you would like.
It feels silly. Like looking back, it feels silly.
Okay, cool.
So, and I say that because like, I'm a very smart person and I'm not afraid to say that. Like I have a doctorate level education as a first gen college kid. Like that's really cool.
You can swear on this podcast. It's okay.
Oh, awesome. I'm from Jersey, so let's do it. So at my school where I was at, because it was a 3-in-3 program, you didn't have to reapply. You didn't have to take a GRE. As long as you maintained a GPA, you were able to stay all the way through. Very rare, not a lot of those in the country. But the requirements were very high. So if you dipped under, like into that 2.8, 2.9 range, which high B minus, like right on the cusp of a B, like academic probation, like you need to get your like shit together. You're failing out. And in the moment, it feels like, oh my God, I'm not as good as everybody else here. I don't deserve to be here. And I'm like, wait, a high B minus, like that means that I am getting about 80% of everything you are asking me correct. And you're punishing me because I am not retaining 20% of the tiny information that, again, in my practice, I'm doing like, I'm Googling the flexor digitorum, right? Do I know the innervation? Absolutely not. Is that available to me in information? Yes. And so the pressure of that feels silly. And I remember I was sitting with a faculty member. I think it was like my Canese professor who it was my lowest grade, which was like a B minus or something. And I was like teetering and it was like, if I dipped any lower, that would be it. Because you had to like have a certain GPA in the high sciences and a certain GPA overall. And, she was very politely encouraging me to take an extra year, which was not financially feasible. And so it was a very, and that communication wasn't like quite understood on the level of like privilege and understanding. Like I think she was like, but it's better for you. And I'm like, not in the ways you think it is.
Yeah.
And again, I'm like bawling my eyes out. So like I'm a blubbering mess. It's probably hard to understand what I'm saying in this meeting. And she looks at me and I don't think she said it to be mean, but I took it so personally. And she leans back and she's like, I mean, sometimes it's really just hard to be at the bottom of the top 10%. And I was like,
ooh.
And she was like, Well, yeah, like when people get into PT school, they're typically the top 10% of their high schools and their colleges. And then when you come into this entire pool of top 10 percenters and you're the bottom of the top 10%, you're still the top 10%. But that shift feels different. And I was like, I just like, stab me in every visceral organ. Why
Yeah.
don't you?
Yeah.
Because all I take from that is like, oh, I'm the bottom. Oh, I'm the bottom. Like
Yeah.
you're, when in reality, I'm like, wait, no, and that's when, I came home and I was sobbing. And long story short, if you followed my pages in other or heard other conversation, I lived with one of my professors in PT school who kind of like saved me from financial burden. I lived with her and her husband. I still go every year for Thanksgiving. They're
Oh,
the best.
nice.
Yeah. And she comes home and I'm like, I'm a floor balling.
Oh, no.
I'm like, James. And she's like, it's DPT, not DPT GPA. And I was like, hell yeah, brother.
That's cool.
And then I got up and took a shower.
That's funny.
And that's why, again, I feel like it's silly. So I ebbed in and out of this academic probation because, like, one semester I would be like at that like B, that low B threshold. And then and that would be a semester where I had tennis and anatomy and, physics 2 or whatever. And then the next semester it would be like statistics and nutrition. And then I would like pad myself up again.
Yeah.
So like, and I was like, oh my God, like I wasted so much hydration. And it's, but it's again, like the water is so deep, and I don't expect anybody to not feel those feelings. Like, I am not saying that you, in those lows, I am not expecting you to see my post and be like, well, DPTs with anxiety did it. So like, feel your feels.
Yeah.
And then listen to the voice that says, DPT, not DPT GPA, and go take a shower.
Yeah.
Feel your feels and have a cry, dust yourself off, and move on.
I love it. Yeah. I can tell you, I've been asked where I went to PT school many times. I've never been asked what my GPA was. And I honestly, I couldn't tell you.
Yeah.
Enough. It was enough.
It was enough. And that's what matters.
Yeah. You know what they call the person who graduates last in their class in medical school? Doctor,
baby.
Yep. Just like everybody else. So, and I'm curious also just like the supports, and it sounds like you had some pretty unique supports in your perspective, but like when you were on probation, then did the program kind of like, okay, let's take some steps here to help you, to bolster you up or was it more like, suck it up, Chucko, let's go.
Anyone who's not watching the live recording, I just made like the most awful repressed laughing face because I got told like, you're the bottom of the top 10%, get better. Go. You're drowning. Why don't you know how to swim? And mind you, I was also in grad school in 2021, 22. So
a fun time.
So it was hybrid where in a time I was asked to be flexible. And thank you so much for being so adaptable. Yet it felt like no one was adapting to me. And that was very frustrating. That was very like, I am adapting to what you need as a university because I don't have any other choice. Like this is, again, sink or swim. If I am a square trying to fit into a circle peg hole, I am filing down the edges no matter how painful it is to check your mold.
Yeah, there's a power differential there.
It sucks. And like, and that's why someone on my page is like, yeah, we're laughing about this, but then are we talking about a conversation on how to make it better? And, things like this, talking to faculty members too, like it does feel like it's shifting. And that's really, really great to be on the curve of. Again, it's very sad in a way that I have over 30,000 followers because that means on some level, people are feeling this, and that's like, man, I don't want people to feel this. I'm glad we can like come to a term on it, but like, so in terms of support, I had one or two people to really lean on to, and most of that was kind of like, here's one or two things, go follow the rabbit hole. Like no one to hold my hand, which, for better or for worse, like, I'm a very hyper independent person. So probably shoved away a hand or two in my own fault and ignorance. And I think that being like, I had to like fight really hard and advocate for myself, especially with invisible disabilities, my ADHD, my POTS, my endo, those kinds of things that, my TBI, that I can't show you. PTs are really good at understanding disability when they can see the crutch, when they can see that the joint is subluxed. Not very good at seeing it when it's not visible. So I received a lot of pushback on accommodations and support.
Yeah.
And like almost asking for handouts and almost looking like more like just like, oh, I'm not up to par as everybody else, which wasn't true.
Yeah. I encountered that a lot when I was in the clinic, that when I was doing a lot of post-concussion rehab, that
Yo.
the folks that would come to see me who had like the full-blown post-concussion syndrome, meaning they're like 12 weeks plus post-injury and they're still not feeling like themselves, but on the outside, they look fine. And so I remember patients telling me that, because there were several that were also work comp cases that, you know, the injury happened at work, so it was a work comp case, that one of my patients pointed out, she's like, yeah, you see that red car in the parking lot out there? I'm like, yeah. She's like, that's a private investigator who follows me around all day to make sure that I'm not faking it. Because the work comp had hired them because they didn't believe that this patient was still dealing with post-concussive, symptoms. I'm like, that's redonkulous. So
What a waste of resources.
I know. What a way to make someone feel good about themselves.
Yeah. So my advice there is, it's like, sometimes you do have to like barrel down the doors, and that sucks when you're like really, really low. But someone is going to be there with like a door cracked open, like find it and squeeze everything out of it. So
nice. Well, thank you for sharing that. I want to shift gears again now. How do you make a good meme? I'm old, so I don't know how to make a meme. So how do you like, the one that I was just looking at was the kiss cam footage that everyone's been using, I think, for a lot of fun. But your first one was like when the patient asks you, can you look at this, and immediately lifts are gone. They're like, and like, we've all been there, but like, how do you make a good meme? What are the steps? If I wanted to be an influencer.
One. Yes. Step one, have a mental illness. No,
okay. Check. Can do. All right. Keep going.
So especially people like want to start creating content, create as much as you consume. Not everything is going to be good. Like, not everything. My like best performing meme, reel, whatever, are always the ones that like, I'm like, this is just going to like be a filler on the page. And then it like blows up and I'm like, damn. And like the one that I'm like, this is going to be it. I'm going to be huge at like 200 likes. And I was like, So like, you can't take it personally either. I think what's unique about my page is that I do use the same photo for multiple different scenarios.
Yeah.
And I think that's like very unique to my style that I've kind of latched onto. And it actually came from like a place of ADHD and indecisiveness of like, I'm seeing this picture that like, from my scrolling on something else. And I was like, oh my God, that's me when I do this. And I'm like, but this is also when I felt this. And I'm like, why not both? And so I think it's like finding that like little style that's yours, and it's like Elise Myers, she's like, that's a great question. I'd love to tell you like the lead-ins. And it's like, and don't be afraid to like switch up like some of your content. Like my page exploded when I started putting my face on it and started sharing my story. It was supposed to be this anonymous page because again, nobody was supposed to know I was mentally ill. And now it is. I have people following me at CSM and like my name is on stuff, but they're just like, oh my God, I'm sorry. Are you anxiety? And I'm like, yeah.
Are you anxiety? I love it. Yes, I am the embodiment.
With a little orange top of hair from the inside out.
Oh my gosh. You should make a shirt. You should make a t-shirt that just says, yes, I am anxiety.
I should. I was her for Halloween and it was just on brand.
Oh my God. That's hilarious. I mean, it's got to be kind of cool. Like I've been to CSM and I've definitely had like, when the PT Twitter community was thriving, I was a part of that. And I met so many people through that. It was awesome. And so that's kind of a fun little game to play at these conferences. Be like, hey, you're so-and-so in real life. Like it's awesome. It's really fun. But to be like, you're the celebrity that everyone wants to find now. That's pretty cool.
It's so good for my ego.
I know.
It's so good.
I bet. Like, are you going? Like, I heard anxiety's going to that one session. We should go.
Yes. And like, I've been blessed to where last year, now this upcoming year, a booth and a company has asked me to kind of like work with them, which has been a really, really great partnership. And again, something that's just so cool that I get to do with this like adjunct of my career. Oh. And to be in one place, the first CSM where I was like starting to get big, it was like or where are you? I want to meet you. And I was like, I can't wait for you.
Yeah.
I want to, but I can't.
Yeah.
So to be in like one home base and everyone just coming up. And I think the most humbling thing is it's like, your memes got me through PT school. Your
Aw.
memes helped me become friends with my best friend because it showed me that I wasn't alone in what I was feeling. And that's honestly what keeps me going in
Yay.
making this page, because I don't make a lot of money. I don't care. I have a full-time job that I love. And this is a creative outlet that is just opening so many doors that I didn't even know was possible. And that's what's so cool about PTs. There's so many avenues, so many directions. And it really, really is just like, you can make it your own if you like, you don't have, like, if you're feeling stuck, probably, and there are reasons like, you know, financial things, there are things that I want to do that I can't from different barrier levels. But a lot of times it's like, you know, are you limiting yourself in taking that leap? Are you that biggest barrier?
Yeah.
And so it's just a thought question.
I like that thought question. Have you ever considered, this is a bit of a sidebar, but have you ever considered like putting together a presentation and submitting it to like a CSM about doing what you do?
As in like content creation or?
Yeah, just, I don't know, you know, take it however you want it. But truly, I think that if a place like a CSM would be interested in it, because it's a little bit outside of the realm of what they typically would look for. However, I think it would be well received. That's all I'm saying.
Unfortunately, I have tried in a very similar, like supporting neurodivergence in your PT programs, and that has not been selected 2 years in a row. I think that, yeah. But my first CSM, I was invited as this person who represented mental health and invisible disability on a panel of amazing disabled physical therapists. And so there were 6 of us, and we had together a PT who had spina bifida, cerebral palsy, hearing loss, and EDS, a low limb amputee, me, and then a PT who was blind.
Wow.
And all of us just kind of talked about like our lived experiences, universal design, how we can make PT programs more accessible. And we did the same thing the following year, which was really, really magic. And so I think again, it's that the PTs kind of like to grab onto some more like the physical disability stuff right now.
Yes.
And we are starting, and I think Joe Gata is an amazing, amazing advocate in the mental health PT world in that kind of bridge. So if you can follow any of his work, any of his publications, he's an amazing gentleman. And he's also like pushing a lot of waves in like, hey, mental health matters in PT for both providers and our patients. So
Nice.
but I think for now, I just really enjoy the high of being at CSM and like being a person to find.
CSM to me is also overwhelming. I am very much like, I'm the guy when I go to a conference, when it's done at 5, I'm like, all right, peace out. I'll see you tomorrow. Like, I'm going to my hotel room for room service, a shower, in bed, where everyone else is like, let's go out to
After party.
They're like, nope. I've used up my spoons. Sorry. Got none left. So CSM, I have a bit of a love-hate relationship with it, but mostly love.
It is very overwhelming and takes this very specific personality type to rally.
Yes, that's a good way to put it. You got to pace yourself through. It's a marathon, not a sprint.
Yes.
One thing on our podcast, Kay, we are very pro soapbox. So if you have a soapbox upon which you would like to stand and rant, you are more than welcome to. It is an invitation, not a requirement. So don't feel like you have to, but we definitely welcome it. If there's something that's always irked you or something that you're very passionate about. You don't seem like a very passionate person in general, though, so I'm not sure.
No, I'm really mundane. My 2 things is I think PTs need to be more human with our patients. I personally think that PTs should be making our patients cry more. And I say that. But I say that because the body keeps score.
Well, I love that book.
The body keeps score.
Love that book.
And and if you are housing your emotions in your muscles, and if PT is creating a safe enough space for you to move your body in a way that has that visceral response where you release emotion and trauma, because that guarding is going to happen. And if you feel safe enough to release that, I am honored. That you trust me enough to be vulnerable and to release that, and it doesn't belong to you anymore. And I think that that's something that like only comes with building trust with your patients. And that's where I think PTs need to be more honest with their patients of like, no, I get it. There's some days where I come home and I don't want to do my exercises either. You know, I think we get in the habit of like the packet of like, this is going to fix you, do it every day. But, you know, I'm working with new moms and they have 2 under 2 at home and I have a golden retriever and that's too much for me some days. And so it's like, okay, what can I pull back? How do I actually integrate this
Yeah.
into your life? How can I teach you how to move instead of teaching you movements? And again, I think a lot of that comes from like the system, how much time we're allotted per patient, the more traditional outpatient. But I think PTs, like, we have to almost like get out of our own way, thinking that we can fix everybody. And you know, we talked about it like in our talk at CSM about like, you know, some inherent ableism within the PT field, where it's like sometimes you don't need to fix people, you just need to give them like ways to improve their quality of life that work for them.
I tell my
And
students
that's what
to
they're
avoid
looking
using the
for.
word normal. Avoid
Mm.
using the words normal and abnormal because that's a very judgmental term. I like typical and atypical because that
Yeah.
at least is a little more like, is it common or uncommon? But normal and
Yeah.
abnormal, I feel like is a little judgy.
And as a hypermobile person, I love that because like
Yeah.
my joints are not normal.
But they're normal for you, you know?
They're normal for me.
Yeah.
And they do it. They support me. My body supports me. And
Yeah.
it's beautiful and wonderful.
Okay. I want to go
So
back to your, I want to go back to your making patients cry point briefly.
Yes.
Because I'm right there with you. Okay. And I've been on both sides of that as a clinician
Whoa.
and as a patient. And I will tell you as a patient how much I appreciated the fact that my PT recognized that I needed to have a good old cry and allowed me that space. Made a huge difference. But what do you say to the therapist who's like, I don't want to do that. I don't like when people cry.
I would say, why do you not like them crying? Does it feel like you have to fix it?
Ooh, yeah.
Or can you just hand a tissue and be like, yeah, that sucks?
I think that's the hardest part is just, I feel like there's an inherent, so going back to why do people go into PT? To help people. And I think when someone's crying, for a lot of people, I think especially who maybe don't have a lot of experience, I don't know the term I'm looking for here, but like someone starts crying, you're like, I need to help, but I don't know what to do. And this is weird and icky.
Yes.
Versus when helping is really, truly, here's a tissue and let's just sit for a minute. Like, I don't think they realize like passive helping, if you want to call it that. I don't know.
Yeah. Be okay with quiet.
Yeah.
It's hard.
It is
and
hard.
I think, I mean, I'm very, very jaded. I grew up with a disabled father. He has spina bifida. And so like, I've kind of been at this game for a long time before I became a clinician of just being like, lies ain't there. And so I don't expect that. Like, that's something you have to learn.
Yep.
That's something you have to practice as a practitioner. And I think like, it's okay to like be uncomfortable with it at first, but constantly reflect, ask yourself, how can this be better? Ask your coworkers how they handle it, right? Because again, every brain is different. So get that correlated data.
Nice. All right. Cool. Any other soapboxes?
My favorite phrase that I say all the time, and it honestly saved my life and helped me move forward in my PT career, is you can be the entire package and sent to the wrong address. And I want that tattooed on my forehead.
Oh my gosh.
A walking billboard. Because there's so many
hilarious.
times. Yeah, I've walked into spaces and I'm like, who's cold, baby? And they're like, this is a church. And I'm like, you know, like I know what I bring to the table. I know who I am. And that who I am is still growing every day. I'm still shedding my anxiety, my identity as a student.
Yeah.
And, you know, and that is formative. But
That's
I
funny.
know what I have, and it's okay if the space that I'm in is not accepting to that. That doesn't mean I have to make myself less. They can
address.
go find less.
That's great. I love that. All right, I have one last question for you.
Let's do it.
Okay, what's your favorite DPTs with anxiety post? Not the most popular.
Ooh.
What's your favorite?
My favorite one I've done.
The one that you're the most proud of.
Oh,
Did I
that
stump
one's
you?
hard.
Did I stump you?
I know. I like almost have to like feel like I have to like roll back. I would actually argue my PT Barbies that I did
Ooh.
because it was so outside of the box of what I've done.
Okay.
Because I was doing like pretty like strict meme content, strict reel content. I can say like probably when I started making reels and putting my face on things, like I had my own body issues like every like woman in her late 20s has, but the Barbie memes really, when Barbie was popular, was a different creative beat. Like where I was like, okay, like, and that, I mean, my follower count grew exponentially. People started finding me in different ways and I created stickers and it was so fun. And it really showed me that like, yeah, do things different. Keep mixing it up. And as an ADHD person, that's really great.
That is exactly what we need. Nice.
What's your favorite ADHD DPTs and anxiety posts?
Oh gosh. Well, honestly, like first of all, I have the memory of a goldfish, so that's the Wells Fargo one you put up not too long ago. Oh, that one. I sent that to a bunch of I'll just say therapy friends, not necessarily even PTs, but like folks who I knew would appreciate this, and they're all like, "Yeah, that was a good one."
Thank you.
Goodness gracious, well, it still makes me laugh.
Oh, this was fun.
Yeah. Okay. Thank you for taking the time. I will post links to your stuff. Again, if you're not following DPTs with anxiety, what are you even doing? Get on that train. It's worth your while. Yeah. Thank you so much for being here. Keep doing the work you're doing.
Thank you so much. I appreciate it. Bye.
Dr. K. Mastrocola is a physical therapist and the hilarious source of DPTs with anxiety. Do yourself a favor and check out the account if you haven't already. Waves is a production of APTA Michigan. This episode was edited by me and Jen Hood. We are online at www.aptami.org or at APTAMI-Waves. Remember, if you're a PT or a PTA in Michigan, you can earn PDR credit just by listening to Waves episodes. See the show notes for details. Thank you for listening, and may your documentation always be done on time.